Right, and onto some COVID updates from across the region now. Starting off with Assam, 92 fresh cases of the virus have been reported from the state in the last 24 hours. With this, the total tally of cases in the state has climbed to 2,18,832, with as many as 683 active cases. Furthermore, 2 COVID casualties were also reported from the state yesterday, taking the death toll due to COVID-19 to 1,111. On the other hand, 34 COVID patients were discharged in the last 24 hours after recovering from the illness. Meanwhile, Meghalaya, on the other hand, reported 9 fresh cases in the last 24 hours, taking the total tally in the state to 14,135 and the tally of active cases to 104. On the other hand, 4 COVID patients were discharged in the last 24 hours after recovering from the illness. On to Mizoram now, 9 fresh cases were reported from the state, taking the total tally in the state to 4,500 with as many as 44 active cases. Also, 1 COVID-19 patient was also discharged yesterday, and with this latest update, the total number of recoveries in Mizoram have also climbed to 4,445. Meanwhile, the death toll due to COVID-19 stands at 11. On to Tripura now. The state has reported 14 fresh cases yesterday, and this takes the total number of cases in Tripura to 33,554 and the tally of active cases to 70. Meanwhile, 1 patient was discharged yesterday after recovering from the illness. With this latest update, 33,069 patients in total have been discharged after recovering from the virus in Tripura. And Sikkim, on the other hand, recorded another COVID-19 related death yesterday after a gap of nearly 2 months. A 65-year-old woman with comorbidities from Siche succumbed to the virus yesterday. Meanwhile, 23 COVID-positive cases were reported in the last 24 hours in the Himalayan state, taking the tally to 6,286, the highest figure to be recorded after a gap of 4 months. Additionally, there are 56 active cases of the virus in Sikkim, of which 1 is currently in the ICU facility of the STNM hospital. It may be mentioned here that one of the tourists from Gujarat tested positive last week. The group returned to Gujarat immediately after receiving their COVID report. On the other hand, the contact tracing team is preparing a list of primary contacts of the hotel where they had checked in. Night curfew in the state would continue from 10 a.m. until 6 a.m. The government has also decided to speed up the vaccination process, wherein more focus would be given in the rural parts of the state by setting up more vaccination booths.
We have to increase the scaling up, ramp up our vaccination program. Why? Because vaccination is the only alternative available to contain this COVID, and our Sikkimese people will be benefited with this action. And in addition to that, wherever we have kind of interventions like RT-PCR tests, also we will increase wherever flu clinic and other kind of situations happen to our people. And in addition to that, as I told you, the laxity or COVID behavior is not allowed.
And with the recent spike in COVID cases across the country, mandatory COVID testing for people arriving at Mao Gate and Jiribam in Manipur will resume with immediate effect. That's right, viewers. The State Health Department released a statement in which it was mentioned that the test on arrival is being taken up to scale up testing in view of the rising number of COVID cases in certain states of India. Furthermore, the RT-PCR testing at the Bir Tikendrajit International Airport would cost ₹500 per test. COVID testing of persons arriving from identified states have already started, and considering the sustainability of the arrangements, it has been decided to collect a charge of ₹500 each per test, said the statement.